Let's move on now. The big event for the coming week will, of course, be the COVID-19 vaccination program that should be rolled out anytime from January 13th. Ahead of that, of course, we saw a second dry run on Friday in every district of the country to check the preparedness. So in every district of the country, the preparedness had been checked. And on Monday, the Prime Minister will be meeting with all Chief Ministers of states and union territories at 4 p.m. on this very issue. Let me go across to Karishma Asadani with this story. Karishma, we've seen a dry run. Now we're going to see the Prime Minister chair this high-level meeting with every Chief Minister in the country. What are you picking up?
Well, right, the Prime Minister of the country, Narendra Modi, is supposed to meet all the state CMs on Monday at 4 p.m. and this is clearly a meeting on COVID vaccine, which is coming in days before the government is all set to roll out the vaccine. As per sources, January 14th is the day, likely on the festive day of Sankranti, that government is planning to roll out the vaccine. We know that the preparations have been going on in terms of transportation of vaccine. We are picking up that yet the transportation of order from Serum has not yet started, but it's likely going to happen by starting off next week. This is PM's first such meeting after the regulator approved authorization and emergency use of both these vaccines, and it's yet a major moment for India, which has been able to be one of the first countries in order to roll out two vaccines for its masses. In fact, Health Minister also recently in one of his press conferences mentioned that we are just days away from vaccinating the vaccine, and that is definitely going to be the highlight of coming few days.
Right, thanks, Karishma, for joining us with that. Now, the government is trying to roll this out by 13th of January, try and make sure that the first jab is on January 13th. But some news coming in as being reported by the Economic Times that the Covishield, that's of course the Oxford AstraZeneca vaccine being manufactured by the Serum Institute, will be delayed by 48 hours. The airlift of the Oxford Serum Institute vaccine is likely to happen on Monday. Transportation may only begin then on Thursday. So is there a delay in the first jab of the vaccine in India? You've got Serum CEO Adar Poonawalla dismissing rumours that price negotiations with the government is what has led to the delay. Serum so far has reiterated that 50 million doses of the vaccine are ready and can be rolled out. And let's tell you how the preparations and the dry run went. Here's a report put together by Team ET Now.
Almost 25 representatives will be given a dry run for the vaccine at this point of time. Now, this is the first step. The first step is the waiting area. Obviously, social distancing has been maintained. There are people waiting here. The first step will be registration over here, where the list of people who have really registered will be there. They will get the list. This is the first checklist. There are almost 3 checkpoints here. The first one, now once you're done with the registration here, you get in here. There are almost 10 vaccination areas and 2 vaccination rooms in Cooper Hospital itself. As you can see, there is vaccination room 1, 2, 3, 4, 5, 6, 7, 8, because there are 8 chambers almost in this room itself. As you can see, what's happening here is that the ID card is being seen. That's not happening there, but here you will see the ID card, and then you will be given a slip. Now in this slip, first of all, it will be checked whether you are registered or not. There will be tick mark, and then the slip will be given where your name, your in time and your out time, both will be considered. Once you're done here is when you come to this part. Now this is where the registration is happening in the app, in the CoWIN app, and once that is done is when the vaccination will be given. Now you can see that the vaccinations are being given. Once this whole process gets complete is when you are being sent to observation for almost 30 minutes for observation center, for observation rooms, and then you're free to go from the exit.
located just behind me is the waiting area where patients will wait before vaccine would be administered to them. Of course, social distancing norms would apply out here and various health workers would be stationed at this place. Located to my left is the vaccination room where the vaccine will be administered. Not only security but also health workers are stationed out here in order to prevent any crowding and ensure that patients come only by their turn. Located to my left now is the observation area where patients will wait for 30 minutes after the vaccine has been administered to them to check for any side effects. Out here, doctors, nurses and other health workers would be waiting. They will keep a strict vigil on the patients to check for any side effects and administer any further medical treatment if at all needed.
This is a dry run to see that flow is in order. When the actual vaccine comes, so everything will follow the protocols so that there is no problem to the general public.
So is there a procedure to limit the number of patients coming in the hospital premises at one particular time? Because social distancing is an important issue. So the number of tokens or the number of appointments particularly, is there a restriction on that?
That is being managed by the government. And we are providing the facilities here. I heard in the meeting there, they have said that there will be around 100 cases to be done per day.
What you see right behind me, the activities that are taking place as far as the dry run is concerned, and of course you have the beneficiaries who are allowed to in fact stand, especially maintain the social distancing. The first step what we look at here is the registration area. Once the names are matched with the list that they already have, which they have prepared over here, after which we understand they are made to sit in this particular seating area. Well, Doctor, can you tell us what really is the entire process? This is after registration. What is the next process?
Yeah.
If you could take us through the...
Yeah, sure. So once they have screened them in the screening area with their identity, and also they ask them for any signs and symptoms, that if they have fever, cough, cold, because in that case they're not supposed to be vaccinated. You can see our vaccinator is ready for the vaccine. The vaccines need to be kept in a cold chain, so the necessary arrangements required for the cold chain are maintained. You can see the ice box here, so that the vaccines are maintained at the right temperature.
Big good news for Karnataka is that I have received an information from the Union Health Ministry. There could be tomorrow or day after tomorrow, probably, we will be receiving 13,90,000 vials of vaccine for the state of Karnataka.